Human papillomavirus, or HPV for short, is a family of over 150 related viruses that infect both skin cells and the cells that form the lining of the mouth, throat, cervix, and vagina. Most HPV infections are mild and resolve without medical treatment within 1 to 2 years. But some high-risk viral strains can cause longer-lasting and more serious symptoms. HPV virus can only reproduce in replicating cells, so the virus modifies infected cells to continually replicate. The rapid replication of infected cells can cause growths called papillomas or warts. The changes made by the virus in infected cells can also induce cancer. HPV is generally transmitted through skin-to-skin or sexual contact. HPV can also be transmitted on contaminated surfaces or medical instruments. HPV is resistant to many commonly used disinfectants and can remain infectious on surfaces and skin for a long time. HPV is extremely common. 80% of the population will contract HPV sometime during their lives. HPV can infect people of all ages, including children. It can also be transmitted from mother to child during pregnancy or childbirth. How can you protect yourself and those you love from HPV infection if it is so common, difficult to detect, and potentially dangerous? Through vaccination. HPV vaccines have been developed which are both safe and effective. HPV vaccines have undergone extensive testing and are approved by both the World Health Organization and the Center for Disease Control. HPV vaccines are made by growing viral proteins in yeast. The proteins are then extracted and purified. HPV vaccines do not contain live viruses and cannot cause infection. The vaccine trains the cells of the immune system to detect HPV. If a vaccinated person is exposed to HPV, the immune cells quickly recognize and destroy the virus. HPV vaccines provide long-lasting protection against HPV infection, but the vaccine does not treat HPV in someone who has already been infected. Therefore, it is important to vaccinate children before potential exposure. It is recommended that the vaccine be administered to children of all genders at age 11 or 12, but can be administered as early as age 9. The vaccine is also recommended for all young adults up to the age of 26 who have not been previously vaccinated. Vaccination is a simple and safe way to protect your children against HPV.